Good morning, everyone. Today is Friday, July the 28th, 2023. I'm Donna Will, Professional Development Coordinator for the Maryland Department of Health's Developmental Disabilities Administration. We welcome you to the monthly series of DDA updates with Deputy Secretary Bernie Simons. On the panel today, we have Bernie Simons, Deputy Secretary for the DDA, Robert White, Director of Operations, Rhonda Workman, Director of Federal Programs and Integrity, Nick Burton, Director of Programs, and Jennifer Metrick, Executive Director of Liberty Healthcare Corporation. Before we begin, I'd like to go over a few things about the webinar. All participants are in listen-only mode. There are two options to hear the webinar, by computer and by phone. And if you look at the panel interface on your right labeled audio, you can click either computer or phone to switch for the best option. We will be recording the webinar and posting the session on YouTube and the DDA website. Today's PowerPoint has also been uploaded as an attachment and is available for you to download in the webinar panel box. If you are listening by phone, you can request that it be emailed. Questions can be typed in the question or chat box in the webinar panel, and we will get to those towards the end of the presentation. So now I'd like to introduce Deputy Secretary Bernie Simons. Good morning, Bernie.
Good morning. Good, Donna. Can you hear me okay?
I can. Sounds good.
Good, thank you. Well, I want to thank everybody who's joining us today for our monthly webinar. And, as you can see, I'm doing some opening remarks, but then, as we move on through the presentation, you're going to hear from Rhonda Workman, Nick Burton, and Robert White in their areas of oversight. And before we begin, I want to reflect on the important month we just are having with Disability Pride and the 33rd anniversary of the passage of the Americans with Disability Act. And I want to share with you that we are having an event coming up celebrating our first anniversary of being a tech-first state. Next slide, Donna. So, as I mentioned just now, July is Disability Pride Month. And in my mind, Disability Pride is every day of every month. The contributions of people with disabilities in our communities is necessary, impactful, and visible. I enjoy seeing and hearing about the stories of Marylanders with disability advocating in the legislature, opening up their own businesses, leading others, and most importantly, being active in their community, because that's what we're all about, being active and participating in our community. So let us continue to celebrate and recognize people with disabilities. And I want to encourage you to share your stories with us, DDA, as how you do campaign. And, we put that out there a few times, asking people if they want to participate, being able to tell their story, and let us help us share it with your fellow Marylanders. And if you're interested, please send it to Dr. Smalls, and I believe her email is available for people. So with that, I think we can go to the next slide. So July is the 33rd anniversary of the Americans with Disability Act, groundbreaking legislation that was signed by President George H.W. Bush that prohibited discrimination based on disability. The legislation created opportunities that didn't previously exist on employment, transportation, housing, community access, etc. And so I was proud to join Secretary Carol Beatty on Tuesday at the National Federation for the Blind for the United States Access Board Town Hall, meaning that she accepted the governor's proclamation from Lieutenant Governor Aruna Miller. Whereas we believe, and this is what it says, whereas we believe in Maryland, which recognizes the unlimited potential of all our citizens, including those with disabilities, to live, work, and thrive in the community. And we at DDA stand committed with our colleagues across the state, families, advocates, community partners, to keep doing the good and necessary work to ensure equity and access for all. Next slide, Donna. So as I mentioned a few seconds ago, August of this year, obviously next month, we're going to host a technology first celebration. It's been a year. We had employment first, housing, self-direction, self-advocacy, etc. And it was a year ago that we decided that, we need to have technology for people so that, they can have the important tools and be innovative and help support people with being more independent, building relationships, having access to their home, workspace, community, etc. So the theme of this year's celebration, our first and annual, will be connecting the dots between technology and person-centered planning. It's critical for us to see how technology can enhance people's hopes, wishes, dreams, and it's related to personally defining what is my good life when I talk about my annual plan, my person-centered plan. And we've had some wonderful partners to raise their hand and join us in sponsoring this event, which represents a truly collaborative commitment to explore the use of technology here in the state of Maryland and within our DD community. So DD sent out registrations earlier this week, and there's also a link on this slide to register, and we look forward to seeing everybody at that celebration. So with that, I'm going to turn this over to Rhonda Workman.
Thank you, Bernie. Good afternoon. My name is Rhonda Workman, and I am the DDA Director of Federal Programs. Today, I'd like to share some information related to the DDA operated waiver programs, electronic visit verification, live-in caregiver exemption guidance, frequently asked questions, and policy reminders. Next slide, please. This slide is a reminder that the DDA operated Medicaid waiver renewal changes went into effect on July 1st, 2023. The changes include, but are not limited to, a variety of flexibilities and options related to self-directed services, increased funding for environmental modifications, and flexibilities associated with dedicated support needs. On this slide, you will find links to various renewal-related resources, including the waiver renewal service summary chart for teams to consider while developing plans, the DDA waiver renewal webinar that was conducted in May, links to the DDA dedicated renewal web pages, and also the link to the DDA Connection Special Edition highlighting the waiver changes. In addition, the DDA's policies and guidance have been updated to align with the July 1st effective date. And please feel free to reach out to your regional office or the DDA Federal Programs team if you have any questions regarding the DDA waiver renewals. Next slide, please. This slide is an update on the DDA waiver amendment number 1 for 2023 that was shared during the June webinar. The Center for Medicare and Medicaid Services is reviewing this amendment for the family supports, and community pathways waivers. The purpose of the amendments are to provide an exemption from the electronic visit verification, or EVV, requirements for living caregivers who provide personal supports and respite services. On this slide, you can find the links to each of the proposed amendment web pages for more information. Next slide, please. This week, the DDA shared information related to the DDA's EVV living caregiver exemption process, including a joint memo with the Office of Long-Term Services and Supports. The memo notes that on August 1st, 2023, the DDA will begin accepting waiver requests for an exemption for EVV requirements for living caregivers who provide personal supports or respite care services. That means that once it has been approved, living caregivers do not have to clock in and out in real time. This applies to both the self-directed and traditional agency service delivery models. Please note that people can request an effective date for this exemption as of July 1st, 2023 or later. Again, the DDA will begin accepting and reviewing exemption requests and attestation forms on Tuesday, August 1st. Please note that the living caregivers must meet the requirements and be approved. This includes providing documentation to confirm the living caregiver's home address. Under the self-directed service model, this means that a living caregiver employee who is exempt does not have to use the Financial Management and Counseling Services electronic visit verification real-time clock in and out system. The living caregiver employee must meet the Financial Management and Counseling Services electronic billing system, including using the web-based application or the FMCS portal. Under the traditional service model, this means that the living caregiver staff who are exempt do not have to submit their service activities to the department using the in-home support assurance system, referred to as ISAS, EVV clock in and clock out system. The living caregiver staff may use any of the forms to submit their time, including the LTSS Maryland EVV mobile app, the interactive verification response, phone clock in and clock out, or through manual time entries into LTSS Maryland. Living caregiver staff for provider agencies should check with their agency on the process that will be used for submitting their time. People who choose to offer the living caregiver exemption should inform their coordinator of community services, or CCS. The CCS will submit the request to the DDA. We have provided guidance and issued that this week, along with posting on our EVV dedicated page. And we've included a link to the guidance here on this slide for ease of access. And finally, we will be conducting an EVV Living Caregiver Exemption webinar next Tuesday, August 1st from 10 to 11. We've also included the registration link here on this slide and look forward to the opportunity to share the process with you and answer questions. Next slide, please. This slide notes that the DDA's frequently asked question document was updated on July 24th. The updates are related to the self-directed services update webinar on individual and family-directed goods and services that was conducted on June 21st. It also includes questions that we received during the June Deputy Secretary webinar and updates to the Service Implementation Plan, or the SIP, questions based on recent updates to the form. We've included links to the slide for easy access to those webinars we've mentioned, in addition to a link directly to the FAQ that's posted on the DDA webpage. Next slide, please. And lastly, just to share on this slide that we are seeking public input on our proposed housing support services policy. You can access that proposed policy using the link provided on this slide. We will be accepting comments through the end of today, July 28th. And just a reminder to submit your comments, you can submit them electronically to the DDA dedicated email address listed here, wfb.dda@maryland.gov. You can also mail your comments to the DDA Federal Programs Unit at 201 West Preston Street, Baltimore, Maryland, 21202. And now I'm happy to turn it over to Nick Burton to share some updates on programs. Next slide, please.
Thanks, Rhonda, I appreciate it. Hi, everybody, it's Nick. I have a few updates on our LTSS transition, the NCI survey, person-centered planning, self-direction, and nursing. So Donna, if you can go to the next slide, that'd be great. All right, so for our LTSS transition, we've been doing phenomenally. It looks like we're gonna have 62% of providers all in by January of this coming up January. In May, we met with about 36 providers who didn't have any billing experience in LTSS, and every single one of them have now chosen a go live date. So congratulations to all of them. We have, so this is this third bullet point here, we believe we're at 0, but we're confirming. But as of last night, we only had one more provider to choose a go live date. So we're going to verify this morning that that is at 0. If it is, we will make sure we share that. But that's pretty amazing. We, gosh, not even a month and a half ago, sent out some information that we needed to have go live dates chosen by Labor Day, and we crushed that goal. So fantastic job, everyone. I'm so excited for what's next and the support that you're all going to receive as you begin to make your transitions. I do want to remind people that haven't made the transition to LTSS yet that we do have technical assistance that is offered by our early adopters group. Yesterday, we sent out some information about how to access that technical assistance in our newsletter. And then we also have a link here on this slide. This is support from those that have gone before you and learned all the ways. So please touch base with them, get some support from them. They are champions here. They're the champions of LTSS and worked through a lot of the questions, concerns, and have answers for you. So please utilize them. They're your peers. They know your business. They know what you're going through, and can be a really nice source of support and guidance. Next slide, please. All right, so we extended the deadline for the NCI State of the Workforce Survey. That deadline is July 31st. Please go take this survey. It is a required survey, and this information helps us plan, make decisions, look at the state of our workforce survey, and determine what we need to do in the state in collaboration with all of you to make sure that we have a healthy workforce. So if you haven't completed that, and we know who y'all are, please go in and complete that. Your regional offices, provider services teams are going to be reaching out to see if you need any support or assistance. We just really want to help you get it over the finish line and get it submitted by July 31st, 2023. If you have any questions about the survey, need a new link, not sure what to fill out in a certain section, please contact Leslie Thompson. I have her email here on the screen. She is more than willing to chit chat with you all day about the NCI State of the Workforce Survey and is extremely helpful with working through any questions you might have. So remember, deadline extended to July 31st, 2023. Next slide, please. So I just wanted to do a quick recap on the UMKC, the University of Missouri, Kansas City, Charting the Life Course road show that we just had last week in all of the regions. First and foremost, thanks for coming out. It was such amazing turnout. I was able to go to one of the events for a while, and the engagement, the collaboration, the ideas that were flowing were just unbelievable. It was also so great to see families and participants also engaging as panel members, telling you how the tools have been helpful for their families. I got to see our own providers and CCS entities get up and share how they're using the tools and how they're incorporating Charting the Life Course principles into their day-to-day work. We also got some really good feedback from a lot of you. In one of the sessions, we got feedback from a diversity, equity, and inclusion standpoint that when we're out presenting to people and to our partners, that our panelists and our presenters represent and reflect the people in the audience. And so that was good feedback for us to take back and to think about how we do better next time that we're out in our communities, to make sure that we are all represented when DDA is presenting. The other thing that I think was really helpful feedback was feedback on what we do next and how we take this information and how we implement it. And we heard loud and clear that you all want more opportunities to come together and to collaborate. And so we will take that, and we will certainly help provide those opportunities, because we also really enjoy collaborating with all of you. We have a survey from the Roadshow. We encourage you to take it. It helps us do better. So please take the survey. There's a link here, and I believe there was a link that was sent out to people who participated in the Roadshow as well. So thank you very much. And also thanks to everybody that participated in helping plan that event. Those kind of things are no small feat when you consider the planning and the organizing that goes into that. So a shout out to our regional offices, a shout out to the person-centered planning team members within the DDA, and also a shout out to our professional development team for really making this go off quite seamlessly. So thank you. All right, next slide, please. Okay, some more information about person-centered planning. So I have been taking a look at our person-centered planning policy, and in light of a lot of the work that we're doing around enhancing our person-centered planning process, I've gone through with my team and made some updates and edits. I'm going to be sharing that with UMKC and also the work group that is working on PCP enhancements. We will then put that up for public comment for all of you to weigh in on. And then I will also be making some PCP manual updates, minor updates, particularly around how to think about one-to-one, two-to-one, particularly around community development services. And then updating that in the manual so that there's just a little bit more guidance. Please remember that as part of our process with UMKC, we will be doing a full update to the manual to be reflective of the Charting the Life course principles and the recommendations from the PCP implementation group. Speaking of one-on-one and two-on-one needs, I want to clarify a couple things. So we all know that folks may have behavioral or medical support needs that require one-to-one to two-to-one services. And generally speaking, those are documented in behavior support plans or nursing care plans. But they can also be documented in the plan, right? So if somebody doesn't have a behavior support plan, or there's some trauma behind behavior support plan, or they actually have a one-on-one need in their community development service program or in the community that has nothing to do with behavioral or medical support needs, that should be clearly documented in the plan. So for example, if I have a person, I'm working with a person who has one-to-one support needs in the community, and it's not related to one-on-one, and it's not related to a behavior need or a medical need, I'd want to make sure that the PCP is reflective of that in the applicable FAE section, the community section, and specific to any goals that I might have in the community. Additionally, you'd want to make sure that it's clear what that one-on-one is doing, why they're needed, and how the service is being utilized and delivered for the person. Please make sure that the PCP is really clear, and that if a person were to pick up that plan, they could easily determine the need for the one-on-one support need. And we'll make sure this is clear in our manual for folks, and we'll provide some examples as well. I also want to share that in January, we sent out some information regarding the provider's role in the PCP process. We often talk about the CCS's role, right, as the facilitator of the person-centered planning process, and we talk about the person's role as the person in the driver's seat, their plan, their decisions. But we also want to talk about the provider role because this is a collaborative team approach. And this afternoon, we'll be reissuing a memo on the provider's role in the PCP process. It's really important to ensure that all team members are playing their part to make sure that the PCP is submitted 20 days prior to the APD date so that it can get approved. Right now, if a plan comes into the regional office 20 days prior to the APD date, there is a 97% chance that it is getting approved by the APD date. That is what our data is showing currently right now. So please work together to get that submitted to the regional office. I did want to also share the top 5 clarifications that the DDA is seeing right now as we're reviewing plans. These top 5 clarifications are a missing or incomplete HRST. So please make sure that the HRST is complete. If it is a score of 3 or higher, that the nurse is reviewing it, and that it is submitted as part of the PCP. The cost detail tool is missing or incomplete. Please make sure that the cost detail tool, if you are billing in PCIS2, is attached and that it is complete and that it is reflective of the services that you are providing and billing through PCIS2. The DSAT is missing or incomplete. If you are not fully billing in LTSS, you are required to submit a DSAT. Please make sure that that DSAT is included and that it is reflective of the services that the person has asked you to provide. This should be done through a collaborative process with the person and their team to make sure that there is limited back and forth on the DSAT. Additionally, we find that there is often a SIP missing, a service implementation plan. As we all know, there is a new SIP, and the SIP is also not required for people who are self-directing their services. The SIP that needs to be turned in from a traditional provider should be reviewed by the team, and then the region will verify that it's completed and that it is present. Lastly, make sure that your behavior and nursing plans are current and attached. So during the planning process, it is very important for your behavior specialists, for your committees, your standing committees to review those plans and to make sure that they get submitted as part of the PCP process. All right, next slide, please. Real quickly on self-directed services, the support broker and individually and family directed goods and services policy should be coming out next week, along with the finalized support broker guidance. We also will be releasing soon the FAQ from the support broker webinar. I really appreciate all the questions that you submitted during that webinar, as it helped us finalize the guidance, and we hope to release that information to you very soon. One thing that I think was a really good topic of conversation during the support broker webinar and the other SDS webinars that we've had this month and last month is that I want to remind everyone, self-directed services are driven by the person. It's the person's plan, it's the person's budget, and it's the person who hires employees and chooses vendors. And employees and vendors work for the person. This is a person-driven system, and the person, whether self-directing or in traditional services, is in the driver's seat. Next slide, please. All right, I think this is the last program slide we have. I wanted to talk a little bit about nursing. Yesterday in our newsletter, we sent out some information regarding the Fatal 5 core competency training that is now available through your HRST account and accessible through your agency gatekeepers. Additionally, folks that are self-directing their services, if you would like for your employees to take training regarding the Fatal 5, which are aspiration, dehydration, constipation, seizures, and sepsis, which are all preventable conditions, you can reach out to your CCS, who can help access your FMCS gatekeeper and make sure that your employees have access to that. This is really a fantastic training opportunity that DDA has partnered with Intellectability on to make sure that people have access to the trainings they need to help prevent aspiration, dehydration, constipation, seizures, and sepsis. So I really hope that agencies, you use this with your team members, and nurses, that you recommend these trainings as part of your plan to ensure overall healthy outcomes for the people that you support. If you have any questions regarding accessing the Fatal 5 core competency training, please reach out to Adrienne Holloman, our Director of Nursing. And I think that's all I have. Next slide,
Yeah,
please.
Thanks, Nick. Good afternoon, everyone, or I should say good morning still. So we have a few updates for you today related to operations. The first one is regarding the FY 2022 and FY 2023 financial statements, followed by an update on the cost detail tool for providers who are billing in PCIS 2, and then an overview of the check tracing self-service function that we have for providers who need to track down payments. And then we'll turn it over to Jennifer, who will give an update on where we are with our quality improvement program. Next slide. Thank you. So the audited financial statements are required for all providers who are billing in LTSS Maryland. So we started to transition providers over in FY 2022, and then obviously continued for FY 2023. So if you have been billing in LTSS for those 2 fiscal years, then you'll need to submit your audited financial statements to us. The financial statements are due no later than September 30th of 2023, and then moving forward, they will be due on an annual basis following the close of the fiscal year. So for example, the FY 2024 audited financial statements would be due by September 30th of next year. And if you have any questions, please reach out to Nick Gabor, whose email address is listed here on this slide. Next slide, please. Okay, yes, I wanted to announce that the cost detail tool for FY has been updated for FY 2024 and is now available on our website. If you start using the tool and you encounter a glitch or some other technical issue, then please contact Nick Gabor. Again, his email address is listed here. Otherwise, please reach out to your regional fiscal representatives for all other inquiries. Okay, and then next slide, please. All right. Finally, if you're missing a payment for services rendered, you can utilize the check tracing self-service option. And so what you would do is send an email to the email address listed here on this slide with the following information. If you have multiple checks that you are researching, then please submit an Excel file format with the above information. The above information will allow them to investigate the matter and expedite the processing of the request. The average processing time for requests is 60 days and can take as long as 90 days for more difficult and or multiple requests from the date of receipt of accurate and required information. So for example, a W-9 and the check information. The check tracing unit asks that providers do not send duplicate inquiries within the 60-day time frame, as this causes additional processing delays. And for any inquiries submitted during non-business hours or holidays or state closures, the next business day will be the official receive date for the check tracing request. Next slide. With that, I am going to turn it over to Jennifer Metrics to give us an update on our quality program. Jennifer.
Thank you, Robert. Good morning, everyone, and happy Friday. So we're going to talk through a little bit of the preliminary data that Liberty has been collecting on behalf of the department over the last several months. So as many of you know, Liberty started working with DDA about a year ago, and we've been developing several different evaluations, developing interview tools, and a variety of different kinds of opportunities for evaluation to really help the department on ensuring person-centered excellence across the system. So you can go to the next slide. So you've seen this before. We have three main areas that we have been evaluating on behalf of the department. We're looking at system compliance. That is mostly comprised of waiver assurance monitoring for the three waivers, as well as state-only funding, ensuring that there's participant and family voice with the National Core Indicator surveying of families and participants, and also doing data collection around CQL's network accreditation. So that's our journey towards person-centered excellence. So what is the data telling us so far? So today we're going to talk through initial data that has been collected over the last several months and represents a variety of these different reviews. And the results from some of the data, now we're just starting to analyze much of it, will provide examples around the following kind of 4 questions. So to what degree are DDA standards being met across the system? That's kind of our foundation. To what degree are participants experiencing quality services and support? So that's where we're hearing directly from participants and families. And then to what degree are systems and practices in place across our organizations, both provider and CCS organizations, that support person-centered excellence? And then that ultimately leads to what degree are personal outcomes of participants being met and also supported through their services. So that we're going to take a quick look at some of the data around that. You can go to the next slide. So in terms of system compliance, we had 4 different samples that we used as part of the reviews. So we did 413 service claim reviews. So we looked at paid services that people in the system received, we looked at those and reviewed those for both financial accountability. Was there required documentation to support those services were delivered and in alignment with the person-centered plan. And then also we looked at staff training qualifications as well. The next sample, we also looked at billing claims, but for CCS agencies. So we looked at 384 randomly selected CCS billing claims. Both of the reviews of the billing claims were an 18-month look back. They started with claims from July 1st, 2021 through December 31st, 2022. So then we also looked at 147 newly enrolled participants and looked at their initial level of care process. So looked at the timeliness of that, ensuring that level of care determinations were made prior to people receiving services, and then the different components about what needed to be included as part of that level of care documentation. And then finally, we looked at 284 randomly selected participants. We looked at their person-centered planning process, all the information that was in LTSS. We also looked at their level of care redeterminations, and also looked at monitoring and follow-up that occurred during that previous plan year. So the people that were in that random selection were those that had annual PCP dates between October 1st, 2022 and December 31st, 2022. Now we'll take a little look at a few highlights from that data. You can go to the next slide. All right, so here we have broken down some highlights in terms of our service billing, our CCS billing, level of care, person-centered planning, and monitoring and follow-up. And so there are benchmarks for many of these are CMS performance measures. That data is collected on a routine basis and shared with CMS by the department. Benchmarks are typically set at 86% or higher. So we're looking for compliance with these basic waiver standards at that degree. We have about, at this point with our preliminary data, about 5 of the 14 performance measures are meeting that 86% benchmark. So you can see that with our service billing and with our CCS billing, the majority of those billings were done within standards. So the people that are receiving services, they're eligible, their services have been authorized in the PCP prior to billing for that service. Over 77% of the claims were supported by required documentation. So this is the first round of these types of reviews. So the provider community does have quite a bit of required documentation. And we had a lot of lessons learned as we were collecting this information and working with providers. One of the areas where we have an opportunity to enhance is around ensuring that all staff on the dates of service are qualified, have the required trainings when they're providing services. So for CCS billing, again, almost 99% of all of the claims were for billable and not for non-billable services. Those going really well. And 96% had activity notes with adequate detail and scope. So to be able to demonstrate appropriate billing. And also that information and the supporting documentation was found in LTSS. Again, very high levels of compliance with initial level of care in terms of ensuring that people have those level of care determinations prior to services. And then we move into redeterminations. There were 73% of the files that we reviewed that had complete one-time LOC determinations. Person-centered planning, we saw that over 67% of PCPs were completed within 365 days. So making that annual mark. And to Nick's point earlier, certainly getting those in at least 20 days prior to that annual date is helpful, and reducing the number of clarifications. So these are some of the things that we can dig a little bit deeper in the data to understand some of the whys behind it. 77% of the PCPs had participant goals that were addressed in their services or natural supports as listed in their PCPs, and 77% also had their HRSPs completely updated and provided as part of the PCP planning process. And then finally, with monitoring, we had over half of monitoring visits occurring at the required frequency. Often that is quarterly, but whatever the required frequency was for that participant, we looked at that. And then also looked at whether or not there was progress documented on participant outcomes. So that was occurring over 70% of the time. And 84% also had documentation supporting that CCSs were monitoring that services were occurring, and they were occurring as they were outlined in the person's plan. So a few highlights on our standards. So we can go to the next slide. So for our National Court Indicator surveys, we had 533 DDA participants that completed the in-person NCI survey, and they could have done that actually face-to-face or remotely. We had over 760 families that live with their loved one with a participant who completed the adult family survey, and 432 families that do not live with the adult participant. They completed the family guardian NCI survey. You can go to the next slide. So just a few highlights from the NCI data that has been analyzed so far. There are hundreds of questions that were answered by participants and families. So there is a lot of rich data that we'll be able to put together in particular core areas to be able to share with DDA and the greater DD community. So here's just a few. So around person-centered planning, here's some highlights from participants that 77% felt that they set their own goals in their PCP. 77% had a community participation goal. So there is quite a bit of work that you can see that's been done around connecting people with their communities. On the other hand, about 37% have a friendship or a relationship goal. Again, this is participants' choice. They may already have tons of friends and opportunities, and that's not a goal for them. But for 37%, it is. And about 35% of participants in the sample had an employment goal. A little bit about how families are feeling about services. About 65% of families indicate that their family member is receiving all the services listed in their plans and when they should be receiving them. And about 77% are satisfied. So they're always or usually satisfied with the services and supports their family member is receiving. And then finally, when we look at a few things related to participant outcomes, participants said on a regular basis, 75% of the time, that they often like how they're spending their days, the activities they're engaged in. 71% have transportation. They feel like they often have transportation to be able to connect in the community and see their friends. About 37% reported having a job, and 32% more would like to have a job but don't have one now. So that's a great opportunity for those participants to engage in employment goals. And then about 33%, about a third, said that they often or sometimes feel lonely. And this makes sense, especially coming off of COVID and just a lot more isolation that happened for all of us. So that's something that we hope to see improve over time. And we can go to the next slide. So we also started doing data collection around CQL's basic assurances and their personal outcome measures. So this was through a process where we were certifying Liberty staff to be able to do the basic assurances and personal outcome measures. There's a significant process that one has to go through to actually be certified in these tools. So this represents a very small number of data, but we did have data from about 9 participants that we included in this, and as well as 9 service providers and 1 CCS agency that participated in those original basic assurance reviews this spring. And so we can go to the next slide. So some of the things that we are starting to see just with this very preliminary data from what we're collecting for CQL is some of the strengths in the system. Definitely saw that service environments are promoting people's health and safety as well as their independence. So that was definitely a strength that is coming out in our system. That data and documentation are there to support evaluation of healthcare objectives in particular, but there was quite a bit of good documentation around that. That all of our organizations, their business, administrative, and support functions are geared being able to on personal outcomes. And so that is definitely, you can see that in the mission, vision, and what's coming through from the agencies that participated. And then also that there are policies and procedures in place that are defining, prohibit, prevent abuse, neglect, exploitation, and mistreatment. So some great strengths as our foundation in our system. And then some of those areas where we have opportunities for growth would be really focusing in on services and supports enhancing dignity and respect of participants, being able to promote people's rights. So that's a huge piece in the work that we'll be doing with CQL over the next few years. And especially with dignity and respect as well as rights, we're going to be able to utilize a lot of the resources that CQL has available. We're going to be focusing in on some educational videos and some tools that really kind of take these theories into specific concepts. How can you practice these within your organizations? What are some ways that we can do this while also maintaining our strengths of having a strong health and safety focused system? So how can we do those things together? And then also some opportunities is really building on those natural support systems and giving some examples of what that can look like. And then also ensuring that our PCP process leads to those person-centered and person-directed services. So a lot of the work that Nick just talked about with UMKC is going to help us get to those outcomes of ensuring the PCP process leads to person-centered practice. All right, and you can go to the last. All right, so if you want more information about what the QIO has been doing, we're putting regular newsletters together. We are going to be putting more and more resources on the web page, the QIO page of DDA's website. So please periodically check there. We have the link here on the slide. All of the standard operating procedures are also there for each of the reviews that we're conducting. And as we make updates, they'll be updated on that site. And that's also where we'll be putting data summaries and future reports as we analyze all of this rich data that's going to help us on our journey. So Donna, you can switch it to the next one. And you guys know where to reach me. And then the next one, I think, closes us out. Thank you.
Before closing out, I just want to revisit the FY22 and FY23 audited financial statements. We've gotten some feedback regarding the September 30th timeline, and it looks like most providers don't start auditing their financial statements until later in the fall. So for the FY22 audited financial statements, please get those into us by September 30th. And then for 23 and moving forward, we'll adjust that timeline to December 31. And that will be reflected in the communication that goes out to the providers who would be required to submit those reports. So thank you all for that additional feedback. Nick?
Yeah. So everybody, if on the screen here, you have our next webinar, which is August 25th, 2023, from 10:30 to 11:30. There's a link to register for that and future webinars with the DDA. And then after you register, you'll receive a confirmation email about joining the webinar. Next slide, Donna. All right, it is everybody's favorite Friday activity, DDA Q&A time. And we have about 20 questions. So I'll start from the top, and the first person to answer a question is going to be Rhonda. And Rhonda, the question is, in regards to the attestation for the live-in caregivers, will you or will DDA accept the difficulty of care attestation that is on file with the FMCS?
Yeah, Nick, thank you for sharing the first question with me. At this time, we are not accepting that as one of the documents. We're happy to explore that. We do have a number of documents noted in the guidance, state issued identification, like driver's license, voter registration, and other items. If someone is having challenges meeting any of those that are available, please reach out to us and we'll see what other opportunities we can do to support that.
Thanks, Rhonda. And we have another EVV for live-in caregivers. How does this apply to agencies that are providing support when there's a live-in caregiver?
Nick, I'm sorry, how this applies to regions?
No, agencies.
Oh, agencies?
Provider agencies.
Yep, the exemption applies to both self-direction and the traditional model. So it applies to agencies. The person would request the opportunity to exempt their staff, the live-in caregiver staff, from the EVV requirements. And then the agency then would determine how they want their staff to be submitting their time based on the guidance that we had provided. So it's an opportunity for both service models to have that exemption.
Great. Ron, I think you're popular this morning. We have, well, a couple of things. I noticed that it's 11:32. We're having so much fun. I'm going to ask you one last question, Rhonda, and then I think we can wrap it up for folks and then do a FAQ to answer the rest of the questions. So the one question is, when will people have access to My LTSS?
Yeah, great question. We are excited to be able to provide that opportunity for people to access My LTSS. We are currently working on information tools, documents, and other guidance to help support logging in and using that. We are also coordinating and reaching out. We have some stakeholders that are interested in piloting the use of those tools and accessing LTSS. We want to make sure that it's accessible and usable for all. So we're going to be doing that in the month of August, and then be providing more information and access to people in September. So really looking forward to that. So stay tuned, more is coming.
Thanks, Rhonda. And we apologize, everyone. I know you all really enjoy the FAQ section. We'll make sure that we keep at least 10, 15 minutes for those in future webinars. We will answer these questions and we will get them out to you. And we hope that you all have a wonderful, wonderful Friday and a restful weekend. Have a great day.